What causes low back pain and hip pain? A symptom is something that indicates the presence of something else. In lower back and hip pain, the soft tissues that are damaged are responsible for the pain. These tissues are mainly nerves, ligaments, spinal discs, cartilage, muscle, tendons, and connective tissues. Rarely does lower back pain come from bones, except in fractures. So when the correct tissues are identified, the solution becomes much clearer. Naturally, the body initiates a full healing process, but often enough, the healing is incomplete, leaving scar tissues and weakened structure that can cause instabilities of the spinal joints and eventual misalignments of the spine. Now, over time, these misalignments contribute to arthritis and lumbar spondylosis, that lipping and spurring around the joints and discs we see on X-ray, bulging or protruding discs, and degenerative disc disease, to pinched nerves that cause radiating pains down the buttocks, thigh, leg, and or feet. Looking at the different tissues, they are injured or irritated by several things. Nerves become swollen and become inflamed due to constraining pressure from swollen joints as the nerves leave the spine and branch outwards. In the case of nerves, the pain can follow down the leg, down to the lower extremities. Ligament pain is caused by excessive stretching and tearing of the partly elastic fibers due to acute trauma, accident injuries, or due to wrong positional stress. Cartilage pain is caused by inflammation and compressive forces due to vertebral misalignments. Muscle pain is caused by overuse that makes the muscle fibers tear or become inflamed. This due to overexertion, a sudden loss of heat, lamig, poor posture, with lower back in wrong position too long. So tendons become painful for the same reasons that ligaments hurt. Connective tissues can be overstretched by mechanical forces or by pockets of swelling due to inflammation. People can hurt their lower back and hips from slouching position or watching TV or from during sleep, even from poor ergonomics at their workstation to excessive sports. Injuries are a common cause of lower back pain. Vehicular injuries, sports injuries, some work injuries. Fortunately, a person can have their lower back and hips checked by a doctor of chiropractic. If there is not a lot of pain, that's even better when there's stiffness or mild occasional pain, before it becomes intolerable. Unfortunately, too many people know little to nothing about chiropractic, and over time, they see their lower back and hip problems becoming increasingly more and more complicated. Time is not your friend in situations like this. In closing, we are enclosing a random list of symptoms that have been reported by patients to have improved following their chiropractic care while they're resolving their lower back and hip pain. So back stiffness and back pain, numbness of the leg or foot, hip pain, knee pain, leg pain, foot pain, leg numbness, foot numbness. Now there are menstrual irregularities, frequent UTIs, erectile dysfunction, infertility, constipation, diarrhea, irritable bowel syndrome, amongst others also apply. Yours in health, Doc Mike.